In the spirit of Halloween, we're going to discuss details of a subject that put fear in the hearts and minds of every soldier and civilian during the American Revolution. This is not a subject that is going to be for the faint of heart, as we are going to go into details that we normally don't. Viewer discretion is advised. Whenever a soldier signed up in the Continental Army, what he could expect from his regiment was to be clothed, fed, armed, but also housed in a very spacious 7x7 A-frame like this, with about 5 other grown men. And the biggest problem a soldier would face in a space like this really wasn't the invasion of his personal space or his bubble. It was something much, much smaller. Come here. This little guy is a scabies mite and caused a highly contagious and uncomfortable condition called the itch. They like to burrow underneath the skin to consume blood, sweat, and to lay their eggs and reproduce. The first sign of scabies was intense itching and a rash. Now, the best way to prevent something like scabies or any infectious disease was prevention. A certain level of cleanliness was required in the Continental Army, especially in camps. The Continental Army's manual even has a chapter specifically devoted to cleanliness in the camp, and according to that chapter, it says the following. One officer of a company must every day visit the tents, see that they are kept clean, and that every utensil belonging to them is in the proper order, and that no bones or other filth be in or near them, and when the weather is fine, should order them to be struck about 2 hours at noon, and the straw and bedding well aired. If keeping the men clean, however, didn't work, the surgeon would have to treat it himself. The surgeon would create a topical ointment called a salve, consisting of 2 items. The first was lard, and the second was sulfur. Now, the resulting mixture looked a little bit like this, and it smells a lot like it looks, so make sure to bathe yourself regularly. Now, scabies were not the only kind of creature that a soldier would see or experience in a tent like this. There could be spiders. I actually just saw one the other day. It could be ticks. It could be the occasional snake. Or it could be something in your hair. There could be lice going around from soldier to soldier while encamped. Some of them could carry a disease known as typhus. Typhus was also nicknamed camp fever because it was so highly contagious in campsites. Now, symptoms to expect with typhus typically were fever, headache, severe pain, low pulse, and a rash brought on from the lice, and occasional constipation. So the first thing a surgeon will want to do once a patient was confirmed to have typhus is get that patient away from the general population. You see, surgeons of the 18th century may not have had any concept of germ theory or viruses or anything like that, but they did understand the concept of contagion and isolation. Typhus was also categorized as a putrid fever because there was usually a foul odor associated with the disease. So, to rid the hospital and the patient of that foul odor, surgeons were typically applying things like apple cider vinegar and other acids to try and neutralize all of the smells associated with the disease. The idea was that disease could be traveling in the air alongside the smell, so if you get rid of the smell, you might actually limit the infection. And thankfully, things like apple cider vinegar, they were acidic enough to truly clean surfaces. I mean, certainly it wasn't going to be 100% effective, but it was better than nothing. As far as the patients themselves were concerned, they were typically given a warm, relaxing diet of clear broths. It's probably the only thing they could stomach, and hydration was encouraged to try and reduce the fever that was typically present with the illness. Now, in addition to that, sometimes patients were encouraged to do something other than sweat. This drug is called Ipecac, and it was going to cause profuse vomiting. The whole idea behind the vomiting was to rid the body of any irritants that could prolong or worsen the disease. Hydration was encouraged for most sick patients, but the water here could cause its own set of issues. It was called dysentery, and this time it was nicknamed the bloody flux, because symptoms to expect with dysentery were first the bloodiest case of diarrhea that you've ever had in your entire life. plus abdominal pain, plus cramps, plus fever. Wasn't a good time. Some surgeons recommended to just let dysentery run its course, while others recommended to purge the system of the disease, or attempt to purge the system of the disease, with things like castor oil, which is a pretty intense laxative. As for the abdominal pain, anodynes like laudanum could be prescribed to help out with the pain. Now, laudanum was a mixture of two items. It was alcohol and it was opium. Now, as for that persistent fever, hydration would be encouraged. Let me do that again. As for the fever, hydration encouraged sweating, and sweating encouraged the internal temperature of the body to drop. But the problem with hydration is dysentery is a waterborne disease. Notice any issues there? While typhus was classified as a putrid fever with a low pulse, dysentery was classified as an inflammatory fever, and one potential treatment for inflammatory fevers is arguably one of the more infamous procedures of the 18th century. The practice of bloodletting is thousands of years old and was still practiced at the time of the American Revolution. It was intentional blood loss, and while ill-advised in the 21st century, it made total sense to some 18th century surgeons and physicians. One doctor, by the name of William Buchan, in his treatise on the prevention and cure of diseases, writes that he's not a big fan of the practice. Amongst common people, the very name of a fever generally suggests the necessity of bleeding. This notion seems to have taken its rise from most fevers in this country having been formerly of an inflammatory nature, but true inflammatory fevers are now seldom to be met with. Sedentary occupations and a different method of living have so changed the state of disease in Britain that there is now hardly 1 in 10 where the lancet is necessary. Another physician, by the name of Hugh Smith, wrote a pretty decent explanation for why the procedure was done in the first place, at least for fevers. He writes that as bleeding weakens and destroys the actions of the vessels or organical parts, upon the same account it lessens the heat of the body and the motion and impetus of the blood throughout the whole vascular system. For as the friction and attrition of the fluids against the solids are a chief cause of heat in the living animal. Okay, so hear me out. Bloodletting was not this catch-all treatment. You know, I know in the modern day, the myth with bloodletting is that, yeah, a surgeon back then, if you had a head cold, he would bloodlet you. If you had a broken leg, he would bloodlet you. If you woke up in the morning and you felt just slightly under the weather, he's going to cut you. It wasn't really the case at all. Bloodletting was reserved typically for just fevers and inflammation, and even then, it wasn't done in every case. You know, take typhus, for example. That type of a disease typically presented with a low pulse. You don't want to bleed somebody that already has a low pulse. Somebody that has a rapid pulse, though, and a high temperature that just will not go away no matter what you do, yeah, they may consider it. They're still not going to feel good about it. But anyway, when a surgeon made the decision to finally bloodlet somebody, it wasn't going to be buckets at a time. It was typically going to be 10 to 12 ounces at most, and it's not all going to be taken out in one sitting. It's all going to be collected in a bleeding bowl, like you see here. You may notice there are lines on the inside of that bowl. That's going to give the surgeon a measurement of exactly how much he's removing. But when the procedure was decided upon, typically, the patient's sleeve was going to be lifted up, and one of the 3 veins in the elbow is going to be pierced with a thumb lancet. We'll go ahead, open that up, and hold the bowl underneath. Now you have to remember what Hugh Smith wrote about bloodletting. He said that, well, it does damage the body. At the same time, it lessens the heat of the body. He believed, like many surgeons and physicians believe, that heat in the living animal, as he wrote, was caused by the blood. So the idea was they're reducing what caused the excess heat in the body in the first place. Sometimes it worked, other times not so much.
You know what else made a soldier bleed?
What? Throughout the course of the war, the Continental Army sustained roughly 25,000 to 26,000 casualties, and only a small fraction of those casualties were due to battlefield injuries. But nevertheless, there was a physician and professor of surgery at King's College named John Jones who wrote an entire book on the subject. and he has an entire chapter devoted to gunshot wounds. Let's see what he says. The first intention, with regard to wounds made by a musket or pistol ball, is, if possible, to extract the ball or any other extraneous bodies lodged in the wounded part. A probe would be used to locate the ball, while a pair of rounded forceps would be used to extract the ball itself, and if necessary, a scalpel may be used to aid in the operation. Although Jones recommends as little search as possible with the probe and forceps due to the inflammation and pain they may cause, he recommends not to search for anything below the depth of the finger. If the wound is too narrow, the surgeon may have to dilate the orifice to allow easier access to the ball, as well as to allow a free discharge of matter from the wound and to let it drain. The next object of attention is the hemorrhage, which must be restrained, if practicable, by tying up the vessel with a proper ligature, as no styptic is to be relied on. This would typically be done with a tenaculum. It would be used to expose the bleeding vessels and to tie them shut. If the wound was sustained to an appendage, then a tourniquet or leather with fillet and stick could be used to apply pressure to the affected area. All right, how you doing, soldier?
No! God, please, no! No!
Soldiers might also experience blunt force trauma to the skull on the battlefield. Trephination is the process of drilling into the skull to relieve pressure. Surgeons understood that undepressed fractures of the skull could result in inflammation and a buildup of fluid against the dura mater of the head. A trephine could be used to drill into the fracture, remove a portion of bone, and provide drainage. When the operation is determined on, it is generally performed in the following manner. The patient being conveniently seated on a low chair or lying on a bed with his head firmly fixed and supported by the assistants. The operator, with a strong scalpel, is to divide the scalp with the pericranium quite down to the bone, and having discovered the fracture, is to trace it to its utmost extent in order to fix upon the most advantageous spot for making the perforation. The crown of the trepan being then applied so as to embrace an equal portion of the bone on each side of the fracture. If it be small and undepressed, the operator works his saw until he has made a furrow in the bone sufficiently deep to prevent it from slipping. Then, removing the pin, he continues the operation pretty briskly, taking up the crown every now and then to clear the teeth. So as I was filming this, I realized that the replica trepan that I was going to use is actually too dull to go through plastic, so I'm improvising. When the bone is so nearly divided in circumference of the circle as only to adhere in one small part, it may be easily taken out with the forceps.
Now, probably the most infamous procedure of the 18th century that a soldier would have to endure was this procedure right here. It's an amputation saw, and while amputations were common in the 18th century, they were not nearly as common as you may have been led to believe. If a surgeon noticed that there was a broken bone or dislocated joint, first order of business is to fix the dislocated joint, to fix the bone. But in the case of a shattered bone or a compound fracture or an infection that has gone past the point of no return and starting to migrate up or down the limb, then this may be considered. But just like bloodletting, surgeons aren't going to feel good about this either. Now, if an amputation was finally decided upon, the following apparatus should be prepared in a separate room.
A large dish with a compress to be placed over the vessels made in the form of a roller between 2 and 3 inches wide and of sufficient length to pass 2 or 3 times round the limb. Next is the tourniquet, or leather with fillet and stick, a yard of tape rolled up, the amputating knife, catlin, saw, tenaculum, crooked needles armed and ligatures of waxed thread, and a pair of straight scissors. If the leg is to be removed, the most convenient posture for the patient is lying on a firm table of convenient height, covered with blankets sufficiently doubled, and pillows to support the head. The operator first fixes his compress longitudinally over the course of the artery in the leg. Then, bringing the two ends of the bandage to which it is fixed, he makes 2 or 3 turns round the limb, with the longest end in drawing it up pretty tight, fastens it with a pin. Over this is fixed the tourniquet, or leather with fillet and stick, and having given it the necessary degree of tightness, he delivers it into the hands of his assistant. Then fixing upon that part where the first incision is to be made, which is about 4 fingers' breadth below the patella, he passes the tape about ½ inch below this part, and making a turn or two pretty close, fastens it with a pin. He then, beginning the first incision on the outside of the leg, as high as he can carry the knife without constraint, divides the skin and membrane down to the muscles. The first incision being completed so as to even mark the muscles rather than suffer any adhesion of the adipose membrane, the assistants are to draw up on the skin as high as possible when the muscles are to be divided by 2 semicircular incisions, quite down to the bones. The ligaments must then be separated by the catlin or point of the amputating knife, pushed between the bones, which are then next to be carefully sawed through. Bleeding vessels would then be taken up with ligatures by use of the tenaculum or crooked needle and thread. The skin that was pulled up over the stump would be pulled down, closed, and given simple dressings. Now y'all have a happy, safe, and healthy Halloween. That's all I got time for, guys. I'll see you on the next one.